Greetings. Let us talk about endoscopic loop ligator, or otherwise known as endoloop. These are my acknowledgements, and today's learning objectives include the following. We will learn about the uses of a loop ligator in GI endoscopy and how to handle the device. As you can see here is a large polyp with a thick stalk that tends to contain multiple large feeding vessels. And if you cut the polyp, there are two big risks. One, risk of immediate bleeding, and number two, risk of delayed bleeding once the patient leaves the hospital. These two risks could be minimized by using an endoloop and ligating the blood vessels before the polyp stalk is cut. So as you can see here, the loop has been brought down from the head of the polyp to the stalk, and the loop is being slightly closed and then tightened and deployed. So there are two steps: how to open and close the loop and how to tighten the loop and deploy it. So let us learn about the structure of an endoloop device. As you can see here, like most devices in endoscopy, they all tend to have a similar structure. You have a catheter, you have a handle, the handle has a thumb ring and a slider. And in this one, you have a sheath that covers the loop and the wire that is going to the loop. And if you move the sheath forwards and backwards, the loop can be drawn back into the catheter, making it into a closed position. And if you pull the sheath back, it comes out and opens into an open position. So moving the sheath forward and backward will either open the loop or close the loop, right? And then you have a slider, and once you start using the slider, and as the loop gets tightened, there is no going back. You can only keep on tightening and then deploying the loop. So sheath, you can open and close the loop. You can do multiple times without a problem. But once you start using the slider, it will tighten and tighten, and then ultimately you'll end up deploying. So let us learn about it. Here is the plastic sheet. As you push the plastic sheet forwards, the loop gets enclosed and it goes into a closed position. If you pull the plastic sheet back, the loop comes out. So pushing the plastic sheet, loop gets enclosed and goes into a closed position, and then pulling it opens it. So if you practice this, you know how to move, play with the loop without losing anything. Okay. And once you're happy that the loop is around the stalk, where you want it to be around the stalk, then you can get your thumb into the slider, into the thumb ring, and the forefinger and the middle finger onto the slider, and you close it. The loop tightens, and then if you open the slider, the loop gets deployed. So once you start holding on to the slider, it is an irreversible step. So you can use the plastic sheet and play with the size of the loop. And once you're happy where the loop is located and you want to deploy the loop, then you go to the thumb ring and slider and close your hand, and then it will deploy the loop. So let us look at it, how it happens in a patient here. So here you have you introduce the loop in a closed position. That means before you give the endoloop to the physician, you push the sheath so that the loop is pulled back into the sheath, and then the endoscopist passes that instrument down the biopsy channel, and once it comes into the view, you pull the sheath, open the loop, and the endoscopist tries to get the loop around the head and onto the stalk, and you can adjust those movements by pulling and pushing the sheath. And once the endoscopist is happy that he is able to get to a point where he wants to deploy the loop after tightening the loop, then you get your thumb into the slider, thumb ring, and your forefinger and middle finger onto the slider, and you close your grip. The loop tends to get closed with that plastic sheet there that you see, and then as you open the slider, it unhooks and releases the loop. So in other words, it's very important to keep in mind how to play with the plastic sheet to open and close the loop. And when it comes to the deployment, you get to the slider with your thumb in the thumb ring and the forefinger and the middle finger onto the slider, and you close your hand. It will tighten the loop, and then as it's tight, once the endoscopist is happy, he will say deploy. Then you open your hand and the loop gets deployed from the device. So let us look at what happens to the polyp when you put a loop. Here is a polyp with a big, thick blood vessel. You have a loop around that polyp and you deploy the loop. As you can see, the blood vessel goes into spasm and occludes the blood flow. The polyp tends to shrink, and there's no more blood flow into the polyp, and you get your snare, you cut this polyp, and there will be no bleeding, and you remove that polyp in a net. So we have learned about the role of endoloop in managing pedunculated polyps, especially preventing bleeding. The loop has also been used in other circumstances like closing perforations or large defects. The most important thing in a loop operation is you would not lose anything as long as you are playing with the plastic sheet, moving forwards and backwards to open and close the loop. Once you get your hand onto the slider and the thumb ring and you close, it is an irreversible step. I hope this is useful. Thank you.